Doctors' offices, emergency rooms, and urgent care clinics continue to see children with RSV. The common respiratory virus infects the lungs and breathing passages. The CDC says if serious, especially for infants and older adults, RSV can cause hospitalizations. The state health department says even though cases of the illness spiked last month, state data shows there is a downward trend. As KXAN investigator Arzo Dost explains, by next RSV season, there could be a vaccine with ties to UT Austin.
Chelsea Carr's little boy is still recovering. The Georgetown mom says the 1.5-year-old was diagnosed with respiratory syncytial virus, or RSV, and flu recently.
He had 102.3 fever. And he was just crying, and he was like inconsolable.
She says they were notified by his daycare that he had been exposed to another child who had RSV.
We proceeded to try to go to an urgent care, tried to go to the pediatric urgent care in Round Rock, and nobody had RSV tests. So we couldn't get him in at his pediatricians in Round Rock either.
State data shows for PCR testing, which is a nasal swab and more commonly used, a peak of roughly 1,300 positive RSV tests in mid-October across the state. But in recent weeks, the numbers have been trending down to less than 1,000 positive tests. Last year, during the same time period, the data shows less than 500 positive tests across Texas.
An RSV vaccine has really eluded researchers for decades. RSV was first discovered in the mid-1950s, and it's been difficult to make a vaccine.
Dr. Jason McClellan is a vaccine developer and a professor of molecular biosciences at UT Austin. His work was critical for the COVID-19 vaccines, but before that, in 2013, he was engineering a breakthrough to combat RSV when he was at the National Institutes of Health's Vaccine Research Center.
Do you think by next RSV season we could see a rollout, or are we talking years?
The clinical trials have been going on for years, and the phase 3 results are coming out now. I think it's the expectation is that we will have licensed RSV vaccines sometime next year in 2023, probably in time for the peak season.
He says the clinical trials have been for older adults and pregnant women so far.
Pfizer just had some very positive results for maternal immunization. So in that case, you would vaccinate a pregnant woman in their third trimester. That would elicit high titers of antibodies against RSV that would then be passively transferred to the newborn. And then those antibodies would protect the newborn for maybe the first 6 months of life, which is really when RSV is particularly bad for the newborns.
And then how about older kiddos?
Likely there will be additional trials where you start to dose down, similar to what we saw with COVID, where the vaccines were first authorized for use in older adults, and then kind of age de-escalated down to 11-year-olds, 5 to 11. So it's just, we have to be very cautious with vaccines in children.
For families like the Carrs, right now, they're just monitoring their little one closely.
So he's 24 hours plus with no fever.
They say they're grateful they were finally able to get him tested for RSV, especially since not all children can get tested. The pediatricians and urgent cares we checked with say they only test younger kids up to 4 years old.
If something seems a little off, or if they seem a little more fussy than normal, then just really pay attention to them and then act on it early.
Arzo Dost, KXAN investigates.
Dr. McClellan's work comes as UT recently launched Texas Biologics, which he leads. The new initiative will research vaccinations and treatments for a wide range of diseases, cancer, and neurological disorders. As for RSV, the state health department says the illness can begin 4 to 6 days after someone was exposed to the virus. Typical symptoms include a low-grade fever, congested or runny nose, cough, sore throat, headache, fatigue, and occasional wheezing. In severe cases, symptoms may include a worsening groupie cough, unusually rapid breathing, difficulty breathing, and a bluish color of the lips or fingernails caused by low levels of oxygen in the blood.